This is the second of two videos on chronic diarrhea and will discuss diagnosis and treatment. The patient may be referred to a specialist if there are additional symptoms called alarm symptoms. These signify that there may be a more serious underlying condition. The alarm symptoms include age is 50 years or above, if fresh blood is noted in the stools, if stomach pain or diarrhea occurs at night, if there is any unexplained weight loss, if there is fever, if there's a family history of colon cancer or inflammatory bowel disease, as these conditions can run in families. Let's next talk about what investigations are done. After taking a history, physical examination, the doctor might proceed to further investigations. This includes blood test, full blood count or FBC, liver and kidney profiles, and thyroid test. Another blood test called a CRP, which looks for inflammation. A blood test for celiac disease in high-risk population. Stools for calprotectin. Calprotectin is a protein that is raised in patients with inflammatory bowel disease, which is one of the main conditions that must be differentiated from the irritable bowel syndrome. In irritable bowel syndrome, the calprotectin level is normal. Stools culture to look for bacteria, and stools test for parasites. Stools to look for a toxin called C. difficile toxin, particularly in patients where diarrhea might be due to antibiotics. An endoscopy called colonoscopy. An endoscopy called colonoscopy, where a thin fiber optic scope is passed from the anus all the way up to the whole length of the large intestine. This is done if the following three conditions are suspected: inflammatory bowel disease, microscopic colitis, and cancer of the colon. Another type of endoscopy called a gastroscopy might be done. Gastroscopy is where a thin fiber optic scope is passed from the mouth to the stomach. This is done if there is a suspicion that there is small intestine malabsorption. Also, if celiac disease is suspected. During gastroscopy, the doctor will perform a biopsy through the scope and obtain some tissues from the upper part of the small intestine. Sometimes imaging studies may be indicated if the diagnosis is still uncertain. These include ultrasound, MRI, or CT scan of the abdomen. These tests are done particularly if disease of the small intestine, pancreas, or cancer is suspected. CT scan is a test used to diagnose bile acid malabsorption. This test uses low-dose radiation and can be expensive. Few centers offer this test, so the most common approach to diagnose bile acid malabsorption is called a therapeutic trial. The patient is given a drug that binds bile acid, and bile acid malabsorption is said to be present if the symptoms improve. So these are the list of tests that may be done in patients with chronic diarrhea. Let's now talk about management. Management will depend on the underlying cause. Many of the conditions can be treated once a proper diagnosis is made. I will discuss briefly the management of the common causes of chronic diarrhea. Irritable bowel syndrome. If all the investigations are normal, the doctor may attribute chronic diarrhea to irritable bowel syndrome. Please see the video on irritable bowel syndrome for further information. FODMAP intolerance. Please see the FODMAP video for further information on management. Bile acid malabsorption. It is treated with a drug that binds bile acid. An example is a drug called cholestyramine. Inflammatory bowel disease is treated with drugs like 5-aminosalicylic acid, steroids, and immunosuppressive drugs. Certain parasites like amoeba and giardia are treated with an antibiotic called metronidazole. Bacterial infections, they are treated with antibiotics. Microscopic colitis is treated with antidiarrheal medications and steroids. Celiac disease, which is due to allergy to gluten, is managed by being on a gluten-free diet. Small intestine bacterial overgrowth or SIBO is treated paradoxically with antibiotics.